Good afternoon, I'm Dr. Joseph Rucker. I'm going to give you some information this afternoon on breast reduction surgery. The typical patient that comes in to see me gives this following history. Dr. Rucker, when I was 16, I was large-breasted at that time. I wanted to be a little bit more active in high school. I wanted to be involved in some sports, but because of my chest wall size, I felt it might not be a good option for me. I got a little bit older, got into my 20s, got married, maybe had a couple of kids, and my breast size even increased after that, especially during my pregnancy. I started to notice some symptoms, and those symptoms usually are bra strap irritation, chest wall heaviness, upper back pain, lower pain, rashes beneath my breast. And after complaining about this for a period of time, I might have shared my information with my mother or my primary care physician. After sharing this, they usually tried some conservative measures in order to improve my symptoms. And those conservative measures usually consist of chiropractic care, physical therapy, heat treatment for my back, massage for my back. I might have even tried some anti-inflammatories or muscle relaxants for my back. Over a period of time, even these conservative measures didn't help me very much, so I was referred to a plastic surgeon for evaluation for potential functional reduction mammoplasty, functional meaning that it might be covered by an insurance carrier. During the initial consultation, I examined the patient and got the previous history, which is most common. Most patients that I see in the 2,500 breast reduction procedures that I've done, most patients are physically 5'2" to 5'6". They come in with a bra size of 36 triple D usually. Their weight's between 140 to 170. They have usually 80% of the symptoms which I outlined previously, and they've gone through the conservative treatments. I can evaluate them at that time and determine if they would be a good candidate for a reduction mammoplasty. After the consultation, I then forward a letter to their insurance carrier for prior authorization to see if in fact their insurance carrier would cover the procedure. The letter usually encompasses their symptoms, their conservative treatments, their height and weight, chest wall size, and the anticipated removal or the weight to be removed from each breast. It usually takes 2 to 6 weeks, depending on the insurance carrier, to get a positive response. If in fact we do get a positive response, then the procedure is usually scheduled and it's done in a hospital. The patient's usually done under a general anesthetic and over an overnight stay in the hospital. The procedure itself, we do not usually, I'd say in 99% of our patients, detach the nipple from the breast tissue. Because obviously if you detach it, you won't be able to breastfeed later or you won't have any sensation. So we take special measures in order to leave the nipple areola attached in order to preserve as much sensation as possible. I would say that 85% of our patients can breastfeed after the procedure. The procedure that we primarily use is the inferior pedicle technique, and the attached nipple areola complex is attached to that pedicle. In most cases, we remove between 400 to 1,000 grams of tissue per breast. The procedure takes about 2.5 hours to 3 hours to perform. As I noted earlier, I've done approximately 2,500 breast reductions over a 30-year period. The blood loss is minimal. I've never transfused the patient. Most patients rate the pain on a scale of 1 to 10 between a 2 and a 5. The patients go home the following day with no need for dressing changes. They're in a support bra with a drain under each arm. I see the patient again in 1 week. The bra is removed and all the sutures are removed and they're evaluated thoroughly. At that time, most patients relate to me that most of their symptoms are starting to ease up quite a bit. I see the patients again in approximately 3 months after the procedure and then in approximately 1 year after the procedure. Recovery for this procedure, those patients that do light work, let's say secretarial work or computer work, are usually back to work in 2 weeks. For more extraneous work, requiring lifting and pushing, we tell the patients they'll be off between 3 to 6 weeks. For running and very strenuous exercises, it'll probably be 5 to 7 weeks. Potential complications or risk from a procedure. The most common complication that I find after this procedure is a breakdown of the scar beneath the right breast. And this breakdown usually happens because in right-hand dominant patients, they do a little bit too much too soon, and because of the use of the arm, they can get a little breakdown in that area, so we take special precautions in order to avoid that potential risk. Infection is very rare. We do place our patients on antibiotics during the procedure and after the procedure for 1 week. There are scars, and the patients are shown to where the scars will be. There's a chance for decreased sensation, even though we take extra care in order to avoid that, but there is a risk of decreased sensation to one or both of the nipples. And that's basically about it. We found that the patients that we examine that are potential candidates for a breast reduction, I would say that 75% do get insurance coverage for bilateral breast reduction.